this is Dr. Ragini from Jata Fertility Center, Gachipoli, Hyderabad. Let's know about laparoscopy, hysteroscopy in infertility. So what are the types of laparoscopy that you initially know? That is called as operative laparoscopy and a diagnostic laparoscopy. So in diagnostic laparoscopy, usually it is, in recent guidelines says that it is not usually recommended just to know about the tubal test or something, but when an ultrasound picture shows certain other type of abnormalities, so we need to look into what is the type, then we advise for a diagnostic laparoscopy. In diagnostic laparoscopy, it's nothing but a small procedure where the small primary ports and two secondary ports are placed with small 1 mm and 0.5 mm centimeters, and then with the help of camera the entire pelvic organs are looked into. First is the uterus, how is it, how many types, some will have two uterus, then we have to know how is the size of the uterus, how are the tubes, how are the ovaries. Ovaries we look into the size and also the tubo-ovarian relationship, means how far is the ovary located from the tube. Normally they are very close to each other, but if there, because of any adhesions or because of any type of infections, there is a loss in tubo-ovarian relationship, then we can restore it in the same setting. Also about the tubes, here also we will tend to see certain type of adhesions. These are also released in the same setting. Importantly, it's definitely checked for tubal patency. Tubal patency is that a dye is passed from below through the cervix and then this spill is noted in both sides. That is called as tubal patency. That also can be known by a diagnostic laparoscopy. And a normal hysteroscopy can be, diagnostic hysteroscopy can also be done. In this, how is the uterine cavity, how is the glands within the uterine cavity. In diagnostic hysteroscopy, we see how is the entry of the canal, how is the cervical entry direction, how are the mucosal glands, how is the cavity and the volume of the cavity inside the uterus. So these are all the small basic things that we look for, and also if there is any what is the opening, how is the opening of the tube inside the cavity. These are the small diagnostic things that we look in a diagnostic hysteroscopy. Then coming to an operative laparoscopy. Operative laparoscopy should never be a surprise when we enter. Always a prior proper imaging is done to know what is that to be done during an operative laparoscopy. Is that a normal scan is taken. If at all a fibroid is noted, a proper fibroid mapping has to be done before we go ahead with the operative laparoscopy. Fibroid mapping means that what is the size of the fibroid, what is the exact location of the fibroid, how much is the distance from the cavity, how much is the distance from the outer wall of the uterus. So entire mapping of all the fibroids, how many ever the fibroids are there, all the fibroids have to be mapped properly before we plan for an operative laparoscopy, because sometimes these small fibroids can be missed in an operative laparoscopy. So the entire mapping gives the direct location where we need to remove the fibroid during the time of operative laparoscopy. Second thing is that proper hemostasis is maintained. I mean, along with imaging, proper blood pictures, how much is the hemoglobin, how much is all the other parameters important for surgery. Once these are done, the woman is subjected for operative laparoscopy. And many doubts, madam, how long should we take before we plan for the next pregnancy? Is that once we go ahead with the operative, we have to know how many fibroids has been taken and what is the site and what is the exact suturing that has been done to the uterus. Based on this, we have to plan the next pregnancy. Usually it will take 3 to 6 months for the healing of the uterus to happen. So once it is done, we will have to plan it accordingly before that. once this has done after 3 to 6 months, before planning for the next pregnancy, a small imaging is again done to know how is the status of the uterus and then plan for the pregnancy. So operative laparoscopy is for fibroids. Also it's for endometriotic cyst. In endometriotic cyst, we should again plan prior to the operative what is the size of the cyst, what is the organs adherent along with the cyst, and how long is she experiencing this type of symptoms, and how much is the baseline AMH for her. So before we plan for an operative laparoscopy, these are the basic tests that we look, that is AMH, how much is the blood picture, what is the imaging, what is the size of the cyst, and what are the organs adherent to the cyst if there are any. With this type of minimum precautions, we have to due respect to the ovary, we'll have to remove the cyst in toto, completely with the wall. We have to be careful during the procedure that what is the AMH value before and what is the AMH value after. There is a tend to fall in the AMH when we do an operative endometriotic cyst excision. So prior counseling is done to the couple, whether how much is the success behind the removal and how much is the what is the procedure post operative endometriotic cyst removal. And also along with this type of, we should always look for the tubal patency in an operative laparoscopy. And what is another method that we do for an operative laparoscopy is that any kind of adenomyosis, severe adenomyosis, when the uterus is bulky, then these are also the cases that an operative laparoscopy can be done. Coming on to operative hysteroscopy is that when there is a small polyp or when there is a septum or when there is any kind of small cavity because of submucosal fibroids or polyps indenting and making the cavity small. These are also the cases that we do an operative hysteroscopy to make the cavity normal and restore the cavity. Another type of diagnosis that can be done is the different types of congenital anomalies, uterine anomalies that we see in operative. These can be managed with laparoscopy plus hysteroscopy. All you need to do is to make the cavity to near normal volume. To know more, please visit Jata so that we can recommend what is best for you. Thank you.